Hi everyone, kia ora, welcome. I am Kim McClellan and I'm from Think On, New Zealand. I just thought I'd jump on and do a quick video. If you're an overseas nurse getting ready for your OSCE here in New Zealand, or even a local nurse working as a healthcare assistant and you want to feel confident, you're in the right place. Self-study can work. You don't need to spend thousands of dollars preparing for your OSCE in New Zealand. My honest answer? No, you don't have to break the bank. Self-study can work if you've got the right tools and the right mindset. A great book like this, my downloadable OSCE scenarios that have 22 scenarios, is so helpful, and a good study plan, which is inside this book. You've got a 3-month study plan that you can really prepare yourself in time for your OSCE exam. 3 months is a good time to prepare yourself for your exam. Taking a long time to get yourself ready. I do realise that there is some restrictions around your bookings, but the sooner that you can start and get a good plan in place, then the better it is. It's all about, in New Zealand, it's really important to think about, it is about practice. It's about verbalizing out loud so that you practice your English. But I just want to really say it's also really important in New Zealand that we listen to our patients. And I can't emphasize that enough. We must listen to our patients, especially in your OSCE exam. Your patient, or for example, your actor, they are going to expect you to be listening. They might test you as well. Like, I wouldn't be surprised if they tell you the wrong date of birth or the wrong name just to see if you're actually listening, and it's part of the test. If your patient suddenly talks about their cat at home while they're in hospital, you might think, oh, that's not nursing. It's not part of my job. Here I'm talking about wounds, or here I'm talking about trying to get somebody off the ceiling because they're having a massive panic attack. But actually, it is nursing, because it's about building a therapeutic relationship with your patient. It's about saying, I can hear you're worried about your cat. I'll see if I can help connect you with somebody who can check on them, or can we talk to a social worker? Even small things like that shows compassion and professionalism. Some really cool key tips for you that I really want you to remember today. Listen to what your patient is really saying, not just the clinical stuff. Show empathy and respect. Keep your communication patient-centered, and practice your scenarios out loud. It's not enough to read them in your head. You need to speak and get comfortable speaking out loud. And that's where we can pick ourselves up from, our little glitches, maybe the mannerisms that we're using. Maybe we're too direct. In New Zealand, our patients like softness. Please, thank you. We feel it, we want to show that compassion, that empathy, not just do the needful, do the necessary. So, in this book, I go through all those sorts of things. If you're wanting to self-study, please check out my resources online. This book will take you through many different elements, from mental health to medication administration, things like abdominal assessments, cardiac assessments, how to manage a AED machine, because some nurses are not familiar with using an AED. These things are really important. It talks about how to communicate with patients, what's appropriate, working within the Treaty of Waitangi and cultural safety, which is so important here in New Zealand. So, this book, along with my 22 downloadable OSCE scenarios, honestly, perfect tool for you to be working in self-directed learning on your own. You can create your own you can create your own practice OSCEs, mock OSCE exams at home. Get your family involved, get your friends involved, get them to be your actors, because in the 22 downloadable OSCE scenarios, you have checklists, you have resources and tools to help you, including scripts for your actors. So your actors don't feel like, if it's a family member, they're not really sure about nursing. There's scripts available for certain scenarios. So, Just remember, you don't have to spend thousands of dollars to pass your OSCE. You need good tools, good practice, and confidence in your ability to build relationships with your patients. If you've got any questions, please email me, kim@thinkon.co.nz, drop them in the comments or DM me. I'd love to help you feel ready and confident. If you're not sure where to access certain things on the website, also please reach out to me. Thanks so much, and I really look forward to helping support you with your studies. I'm cheering you on. You guys have got this. You've got years of experience as nurses. It's just around tweaking those finer details in order to work within the New Zealand context. So, ngā mihi.